One of my all-time favorite procedures to do is an elbow lift. Not many practices do it, but I find when patients come to see us, and a lot of patients travel out of state to come and get this procedure, they tend to be very satisfied after it. So who is a candidate for an elbow lift? Sometimes we'll see patients who lost a lot of weight and they've just accumulated a lot of loose skin around there. Other times we see folks who've had a brachioplasty or an arm lift already elsewhere, but there has been extra tissue left behind around the elbow. But more commonly, it's just folks who tend to accumulate a lot of skin there, and it's just something that's bugged them for a long time. Oftentimes the loose skin, extra skin can be kind of rough there, and this bothers them too. An elbow lift as a procedure is very straightforward. Usually we make a half moon shape, a crescent moon, and what we do is we completely flex the elbow and make sure that we're going to be able to fully flex that elbow after we remove this extra skin. So the elbow's never going to be completely smooth when it's stretched out. Obviously we have to have some sort of skin there to facilitate the flexion of the joint, so it's an extensor surface, so there will always be some loose tissue there, but we can definitely improve on what's already there. Typically the surgery itself takes about an hour. Usually we do it under general anesthetic. In some folks we can do it with local anesthetic. Sometimes we'll use sedation as well. It just really varies from patient to patient and case to case and how much tissue we're going to remove. After we remove the tissue, we then close up the tissue in layers. This is very important because obviously we have to be able to fully flex the elbow. This is a very active joint, so we'll do different layers of dissolvable stitches in there. Scar care after this procedure is very important. Usually we'll use things like silicone gel afterwards. The tape is hard because that joint moves so much, but that's going to be a very important part of the post-operative care that we're going to instruct patients on. Typically we'll wrap the arm after surgery because any extremity when we operate on it is prone to swelling. We'll keep that wrap on usually for about a week and then it can come off. Downtime for this surgery for most jobs really isn't bad. Typically most folks will go back to work within a week or even less, for example if they're working from home or doing a pretty sedentary job. For upper body workouts, we usually cut those out for about 4 weeks just to get that scar healed up properly, but you can start with lower body workouts and things like running and cycling sooner than that. This, like I said, is an example of one of our patients who was very happy with this. She found that the rough skin, the excess skin she had on the extensor surface or the back surface of the elbow, which had bugged her all her life, and it too kind of resolved a little bit when we got rid of the extra skin there, which we do sometimes see as well. So again, it's one of those procedures with very high satisfaction rates. Not many practices do it. I love to do it. We're accepting new patients for this currently here in my practice in Miami, Florida.